it
Sorry.
That's okay. An intermunicipal agreement that Rich, Mike, and I drafted for the Berkshire, Southern Berkshire Public Health Collaborative. It's a draft, so it's certainly subject to any amendments or changes that you folks want. It's a draft based upon other IMAs that we've seen over the years, some lessons learned as a result of those IMAs. And we hope it is user-friendly for you, and we're happy to work with you to continue to amend it in any way that
This is
you
different
folks.
than what you put together?
No, this is what Cheryl sent
Oh,
us.
okay.
This is what we put together. And we've amended it a couple of times based upon some conversations with Jim and based upon other IMAs that we've seen while we've been doing this work for the Department of Public Health. So I don't need to tell you who the members of the collaborative are. You are well aware of the members of this collaborative. However, I do want to speak just a little bit about the goal of these public health excellence grants that you have and that you will be working on. They really came out of the blueprint for public health excellence in Massachusetts that was created by the Special Commission. I was one of the members of the Special Commission. Other members of the commission were folks that you don't usually see in the public health arena. There were people from the Administration and Finance Department of the state. There were people from Mass Taxpayers Association, the Department of Environmental Protection, legislators, both Democrat and Republican, health insurance venues, hospital venues. It was a really broad group of folks that came together to look at what was actually broken in public health and how to fix it, because we have 351 local boards of health, all of whom have the legal authority to enact regulations, all of whom have the exact statutory and regulatory obligations, even though every board looks so different, has different resources, different staffing patterns, but they all have the same legal and regulatory obligations to protect public health. So that's the reason we came together. And we created this blueprint, and there are two overreaching goals for local public health in Massachusetts that came out of this blueprint and that have been embraced by the legislature, the governor, and seeing that the governor is about to sign the ARPA law, which will basically be putting $200 million into local public health, strengthening it both at the state and at the local level. There was clear embracement of this concept by the powers that be on Beacon Hill. So the first goal is to make sure that every board of health can perform the necessary statutory and regulatory obligations that they currently have, that they can enforce the state regulations and the state laws, as well as any local regulations and laws. We found during the special commission that we are woefully unable to do that as a state. In general, we are not able to do right now what we are supposed to do by law. So that's the first goal. And that's where the cross-jurisdictional sharing of public health services comes into play. The commission felt that that was a really good, purposeful strategy to get everybody's boat up to floating on the same tide, basically. And then the second goal is aspirational currently, but it will be a reality in light of the money and the resources that the legislature now realizes through the COVID pandemic that we need. And that's to make sure that every member of every community is healthy and gets what they need both through maternal and child care, smart growth initiatives, tobacco control policy, nutrition, to make sure every member of every community is healthy. And that's implementing the foundational public health services. We're not there yet. And we don't know what all of the foundational public health services are going to be in Massachusetts, because we need to put focus groups together. We need to talk to the residents of Massachusetts about what their priorities are. Other states are in the process of doing this as well. So that's my long speech, but that's really what all of these grants are about. So why are we here? And what gives us the authority to be here to actually create a public health collaborative? And it's the vast majority of these types of collaboratives are done pursuant to Chapter 40, Section 4A. It's not the only way to do it, but it's what most collaboratives have utilized. There are also statutes, Chapter 111, Section 127, Section 27, A, B, C, and D are also ways that you can create collaboratives, and you create what's called a public health district. However, this collaborative is looking at doing it through Chapter 40, which is easier, it's much simpler, and it maintains the legal authority of local boards of health, because that's something that's really, I think, really important, that you're able to create your own policies and your own local laws, and that legal authority is really important. What we're talking about through these 4A collaboratives is sharing local public health service delivery systems, not necessarily all policy promotion. So there is an Exhibit A which will indicate that the Board of Selectmen with Board of Health recommended approval have signed on to this collaborative. Now, normally a Chapter 40, Section 4A collaborative does not require Board of Health approval. It's something that can be just signed by the selectmen. However, the way this IMA is drafted, it would also have Board of Health approval clearly indicated in the document itself. The program manager or the lead agency, as you know, at this point is Tri-Town Health. They would be the lead agency, which means basically that they would be managing the grant and also collecting the money from the Department of Public Health to be used to share the services that the collaborative decides it wants to share. The grant would begin, obviously, on the date that is indicated on the IMA. I don't believe that there's a date, even though we started the work. This is the beginning of the process of creating this agreement. And it ends when the funds are no longer available or when the collaborative wants to end the grant. And then there's a method and a process for doing that. It is not exclusive, and this is important. This means that you can agree to share certain services, but you don't have to agree to share all services. You can deliver other services however your health department sees fit. So I think right now your priority is nursing services. So if you, for instance, you have Title V, which you all do, work to do, you don't have to agree to hand over all of your Title V work to this collaborative. You decide what services this collaborative wants to share. So that's the meaning of not exclusive. What you agree to do as a member of this collaborative is to create and deliver a program where public health staff and resources are shared. And as a result of that sharing, you will be increasing the delivery of cross-jurisdictional sharing of services, including but not limited. And I put that language, we put that language in on purpose so that if you want to share other services down the road, you can share other services. But my understanding, and I think these are the services that this collaborative wants to share, are disease investigations, enforcement, and data reporting.
Yeah.
Do I
yeah.
have that right?
Yeah, there's conversation about evolution down the road.
Yeah, yeah,
the-
and there's room for that in this
Yeah.
agreement,
The-
because what we've done, I'm sorry for cutting you off, I have a big mouth. What we've done is we've put the services in an exhibit so that that can be amended pretty easily if you decide to add or subtract
Yeah.
the services. It's not written into the contract, so you don't have to amend the entire contract, you can just amend the exhibit. Thank you, Rich, for that idea. Now, the organizational structure of the collaborative is as follows. You have the lead municipality, who for the time being will be overseeing the program. The lead municipality is acting for the collaborative, okay? Not for Tri-Town. They're acting for the collaborative with respect to any grant application or gifts or donations that are received. And they're received collectively by the municipalities, not by the lead municipality. They're on behalf of all of the municipalities. Now, not only does the lead, is the lead accountable for the acts of the collaborative, but anything that the lead does has to be approved by the advisory board. So there are two checks here on the actions of the lead. One is that the lead has to act for the entire collaborative, and the advisory board has to approve all of the grant applications that may be made. The lead also acts as the purchasing agent for all contracts that have been duly authorized by the advisory board. Okay, so the lead can't sign a contract on behalf of the collaborative unless the advisory board allows the lead to do that. And the lead acts as program manager. So the lead is responsible for all of the fiscal and administrative functions that will accompany this grant. And in exchange for that, the lead does get a 15% admin fee from the grant because of the work that the lead is doing to actually get the collaborative not only off, get the lead, not only get it out of the train station, but also manage everything that needs to be managed while the collaborative is in existence and doing the work.
If I can just add to that, we don't, it's not all the time 15%. Grants may allow up to 15%. And if there's wiggle room in the grant, we try to do that. We use that for like pay raises for staff and unemployment and stuff. So it's not an automatic thing. It's up to, that's what a lot of grants ask for.
And can we clarify what the advisory board is?
We will,
Okay.
we'll
Okay.
get there. Up to is technically correct. I happen to think that 15%
It's low.
is what the lead should be getting. Okay, here is what the advisory board will look like as part of the organizational structure. I'm sorry. I'm sorry?
Can I ask a quick question about
Sure.
the lead? So the lead is the town of Lee.
Yes.
Correct.
Yes. Because Tri-Town, the fiscal agency for Tri-Town is Lee, technically.
So they're the host agent.
Yeah,
They're gonna be collecting the money and distributing the money. And
it's still gonna come through. Right.
Well, yes, because Tri-Town is Tri-Town is a standalone district,
Yeah,
but our lead fiscal host is the town of Lee. So the nurses get paid, they're actually Lee employees on paper, but they're for the collaborative. It's just,
yeah, and we're gonna go through
Yeah.
part of that.
Ellie has a question.
Okay, that brings up a question that I had that I don't think is an issue for your group, but has been an issue in the past. We have somebody who is employed, okay, on paper, administratively, for a lead organization. What happens when you have an issue where, there's a question of which priority do you see? Is that by being even on paper an employee of the league, does that restrict the employees' priorities, if you will?
No,
And how do we protect that? Because that is something that has definitely happened in the past. Not with you guys, but
so
it's,
very,
I'm sorry, that was clumsy.
so very,
No, I get
so-
what you're
so-
saying,
so-
and we address it in
it's
some
in
of
here,
the
but to
IMA.
answer it, A, there's multiple mechanisms. We have an advisory board, A, this is the governing board. B, we have a work plan that we deliver that is approved by the advisory board, everyone participates in. So there's multiple mechanisms for checks and balances. I totally agree. But I don't unilaterally say, Amy and Joe, you're not going to shut. It doesn't work like that. It's just, they legally, they have to be a Lee employee because they pay the insurance,
Right, no, I
liability,
understand that, but
but-
we've gotten into.
but
a
this
little bit of
board
issue before.
is an active board that makes the decisions on behalf of the collaborative. And to expand quickly on how we don't approve grants, I asked Cheryl, Rich, and Mike specifically to put that in there because Tri-Town is not expanding its workforce. We're just paying the bills
Okay,
and helping to help facilitate this advisory board. The stronger and more active this advisory board is, the less of a chance that will happen.
right, okay.
And it's also, and it's addressed in this draft as well, but also there are scopes of service that the collaborative is agreeing to deliver that DPH is by contract requiring. So there's also overseeing by DPH to make sure that the delivery of services is equitable. Equity is one of the biggest issues moving forward. So if DPH, it begins, and they have a very well-resourced, soon to be even better resourced Office of Local and Regional Health. And they are the ones that will be overseeing these grants, and they are spending a lot of resources on technical assistance providers for these grants. So the situation that you ran into, Ellie, is highly unlikely to occur again.
Good.
And
Okay, great.
one of the lessons learned,
Yeah,
quite frankly.
there was.
Okay, so the advisory board, very important. It's the governing board for the collaborative. It's made up of one member and one alternate from each municipality appointed by the Board of Health. So it doesn't matter the size of the municipality. Each municipality has two members, one member and one alternate who's there as a voting member if the member can't be there for some reason. So it's really important that those positions be filled at all times, that you have that you really make it a point and a priority to have every municipality represented at every meeting, either the member or the alternate. The meetings are convened at least quarterly by the chair or co-chairs. So you have to have at least 4 meetings a year. And again, one municipality, one vote. So that every city, every town here has an equal voice in determining what your priorities are, what services you want delivered collaboratively. And that's a decision by the advisory board, not by the lead. That's not by the employees. That's a decision that the advisory board makes. Okay.
Can I just raise another sort of hypothetical? Everybody agrees that we have to deliver service A, but one of the members doesn't want or need that service. There's no reason
That
can't work.
that can happen.
Uh-huh.
And then the agreement would be to deliver the services to the municipalities that need it.
Mhm.
So, I mean, the advisory board can determine, and that makes sense. There are going to be times when a service isn't needed, by one. I mean, we've got a case out in a southeastern urban area where they don't and they can't, because of certain union issues, they can't have inspectors come into that city and do inspections unless they're a member of the union. So in that case, in that collaborative, they're not going to have, say, a restaurant inspector who is not a city employee go into that city. So there are going to be times where things come up where.
Yeah. And here's an example, Rebecca and Great Baron are a part of the collaborative, but and the goal is to get them to sign the intermunicipal agreement, but we're not actually providing the lead nursing at this point, but we assist Rebecca in other areas. Amy will do some surveillance and backup contract reporting. And so that's a perfect example where they're still part of the collaborative, but Great Barrington may or may not decide if they want.
Yeah, they're not
Primary
forced to
nurses, yeah,
use the
right.
service.
No.
Right.
And again, that's why it's not exclusive.
Mhm.
It goes back to that very important phrase in the agreement. Okay.
Cheryl, can I just jump in for 1/2 a second here? Sometimes in some of these arrangements, there really is no need for one particular component, but the old saying, build it and they will come. If you have somebody that, unless you can't, for the reasons that Cheryl just mentioned, union issues and things of that sort, if you have that resource, you're going to find that you're going to gravitate towards using that resource at least a little more than you may think right now. And as far as being able to just lop off one of the services for one town, I think that the sharpest example I've seen is that where MAHB is administering the grant right now, with the grant administrator on the 2 islands, and Nantucket will never, ever see the inspector. That inspector will stay on Martha's Vineyard just by design. They don't need it. So it's not uncommon. Whoever raised that concern, that's not an uncommon concern.
Okay, so the roles and responsibilities of the advisory board are listed on this slide. I think there are things that you would all realize would be the roles and responsibilities of any governing board. And they're just outlined here. I can go through each one, or you can just look at them on your own. But one that is important is, well, they're all important, but for your purposes right now, drafting and approving the nursing scope of services. That's going to be probably one of the first things on your agenda. And I know you're in the process of doing that right now. You may have.
We already have a work plan approved, so it
Okay,
kind of
but you've been
captures that.
talking,
Yeah.
It's certainly been an issue that's been discussed.
Mhm.
And that will occur for any additional services that the collaborative wants to undertake as well. And you will see here, meeting quarterly, developing annual and long-term goals, a sustainability plan, if that's what the collaborative wants, any collaborative-wide policies you may see that you need at one point, reviewing all the financials, reviewing staff reports, all of these, and again, approving all grant applications and approving all contracts. So the advisory board is the governing board. Everyone has to be accountable to the advisory board. The program manager is someone that would be hired and employed by the lead municipality. I think right now the program manager is Jim, either by default or by choice.
Default.
And it may or may not be. At one point, the collaborative may want someone else to become the program manager. If it grows in leaps and bounds and Jim doesn't have the time, there may be another candidate that you'd want to consider. Again, it's completely up to the advisory boards. But the program manager is going to do everything that a program manager does relative to the fiscal and administrative functions. And Jim touched on this, but all employees of the collaborative will be Lee employees, which is you're really fortunate to have that situation. We have some collaboratives that don't have a municipality as a lead agency for either for union issues or because they don't want to take on the fringe and insurance benefits. And there are lots of reasons where a municipality just won't step up to the plate and do this. And then we have to look at other community-based organizations that might be able to step in and do that. That's what happened on the islands, and it's happening in some other places as well. So it's simpler to have a municipality that's part of the collaborative to be the lead, but it doesn't always work out. In this case, it works out for you folks. So what does a municipality have to do in order to be a member of the collaborative? Again, through the advisory board, you will be consenting to whoever the employees of the collaborative are. You consent that they will do work on behalf of your municipality, and this gets a little bit, Ellie, to your issue as well. And you will direct your own employees to work in good faith with the collaborative's employees, whether they be health agents, nurses, or any other staff down the road that the collaborative might be employing. And again, they're employing these subject to approval by the advisory board. So this touches on Ellie's concern that the staff in a municipality have to work collaboratively with collaborative staff. Sometimes, well, we won't go there. I mean, sometimes it could be a part-time person is now a full-time person. I mean, there are lots of ways that staff come to be for the collaborative. But again, everything has to be approved by the advisory board. And I already stressed the member and the alternate that really need to be there always needs to be a member or an alternate on the advisory board for every town. And I think that the last point, clearly a city or a municipality, a member municipality will make sure that advisory board members, if there are any trainings, either sponsored by the Department of Public Health or by the collaborative or by another entity, if there are training sessions, the members will agree to attend those training sessions. Payment and funding. Again, this is Lee's job as the host agency. The funds that are received on behalf of the collaborative are held with the treasurer of the league. So in a separate collaborative account, so that the advisory board always has access to what that account looks like, how much is in there, et cetera, et cetera. But they're held by Lee's treasurer in a separate account. They can only be spent if the advisory board approves expenditures, and they can only be spent on shared services program. So they can only be spent on what the advisory board agrees are the services that are going to be shared. There may be cases, and Jim would probably have an example, and I don't right now, where the advisory board would approve the request of a member municipality to draw on grant funds. There may be a specific project that a member municipality wants to take charge of, wants to manage. There may be a reason that a municipality may want to manage a specific project, whether it be a clinic or, I'm not sure what it would be. It could be a clinic, it could be like a flu clinic or something along those lines where the member municipality takes on the bulk of the work. But the advisory board would have to approve that kind of a situation. But if they approve that situation, then the member municipality would submit an invoice to the program manager for reimbursement. So you would have to get approval for doing that. And I see Jim's trying to think.
I've
you-
never experienced that.
Well, we can take it out if you
No,
think it's
no,
not
I mean, it's
relevant,
okay.
but
I mean, like,
The
obviously,
purpose, the purpose behind this section, the reason I think it's in there is that if that happens, you need to, it's a reimbursement kind of
Yeah.
payment. So they would expend the money and then they would demonstrate that they've done the service and
Yeah.
then they would get reimbursed. Instead of asking, I want $2,000 to do this, they would have to do it and demonstrate that it was done and then get reimbursed.
yeah, we've done things already, like, we got some supplies, we paid for conference fees for some of the
Mhm.
towns, and 95% of the budget allocation is tied to the nursing program already, and then benefits.
Right, so
there's-
there may not be,
So,
you may not, there may never be a request.
yeah,
for
yeah,
this.
but if there should be, so should we grow to
Should you
get
grow?
more money,
Yeah.
that could get.
I mean,
could
that
happen.
that's just the payment method.
Yeah.
That would be utilized. And if I mean, again, this is a draft. We can do whatever we want with this
I
draft.
think it's okay, like, if we ever get more resource, how we do it with like Tri-Town, for example, like we'll like bill, so there's accounted, because we're audited every year,
Yeah.
with the auditors, it's just, it's more of a, if there's like a special project in Sheffield, for example, and there's resources in the budget, and there's plenty of wiggle room there, we could just deal with that and just deal with the accounting later on. So I think it's fine to leave it in there. It's just, it's a matter of just accountability and tracking
right.
the finances and
That's
stuff.
exactly what it is. Okay, so, and again, I'm repeating myself, but this is really important, that the money that's received from the Department of Public Health can only be used for the shared services, consistent with the agreement. And until grant funds actually land in the account, which I think they have.
Oh, yeah, they're coming in.
Yeah, they're coming in. So there's no cost other than the grant funds to the municipalities in the collaborative. However, for the delivery of your other services like Title V or whatever else you're doing other than nursing, those funds are, you were responsible for the costs of delivering the public health services that you're not sharing in this collaborative.
And if I may share, I know you and I spoke about this in detail before our presentation. So one of the things that some of the towns are aware of, that we're trying to work with some of the towns on trying to utilize the existing VNA funds to pay for capital equipment and like the significant cost for vaccines. That's a separate
That's
thing
separate.
outside of the IMA. So when they
Right.
say there's no cost to do that, if Sheffield wants to provide X dollars to help purchase flu clinics, they're not required to, it's just we wouldn't have the resources to do it. So that's outside of the IMA. And I wanted to make sure that was clear when we were putting that in.
Yeah, we did
whatnot.
discuss this with Rich, and the consensus was that that would be something that would not be included in this IMA.
Hence, exhibit C, right?
Can you speak up?
Exhibit C is up.
Well, exhibit C is, the-
Exhibit C is going to be the exhibit that goes through what the scope of services are going to be,
which is nursing right now.
which is nursing
Yeah.
right
Which
now.
is the way that's spelled out now, but allows for.
It allows for
additional
increasing,
other
for
things.
adding services if you want
For
to.
example, Scott, once we get through all these signatures, and I have questions about how to navigate that at the end, Cheryl, because I know some towns, they feel like it's a significant lift to make any changes once you have a IMA signed. For example, if the advisory board wanted to do a food inspector, we wouldn't have to change the IMA without
right.
heavy lift. We would vote on amending the exhibit, yeah.
Right,
Mhm.
right.
That's-
And Scott, you needed someone to cover perk test, for example, we would add that to the exhibit.
And then it's lumped in with the overall budget. Here, part of the-
Yeah.
Okay.
Okay, and we'll get to that a little more here. Okay, so the difference between this IMA and some other IMAs is that this IMA does not obligate any municipality to fund the collaborative. Okay, this is, you are only obligated to cooperate, to participate, to be voting members of the advisory board, you're not obligated to pay for any of this. You're obligated to participate, but you're not obligated to pay anything. In fact, if that were to change, if you went to a system, if you expanded the collaborative and did require fee for services or anything like that, you'd have to amend
Mhm.
the whole IMA
Yeah,
in order
yeah.
to do that. So rest assured that, and that's very helpful for your select boards to know,
Mhm.
Yeah.
that this does not obligate anyone, any municipality to spend the penny.
That's exactly what I was gonna do.
Yeah.
We just made a note to tell our select boards that. The
Yeah.
tricky part, of course, is convincing the select board that they ought to. And
Because they think everything's fine
at work, and free.
and
It should be
free,
free.
right?
We
They
all
think-
think Great Barrington should pay for everything, you know.
Well, and I think we could talk, you
No,
know,
we're
once-
not gonna talk about Great
I- I- I
Barrington.
I mean, from my methodology is like, once the advisory board kind of approves the content, you know, of the IMA, I mean, I would probably say that you should have a board of health meeting and kind of go through and we can talk about it and whatever, and this is sort of like a reflection, because all these towns are getting significant funds for nursing services,
Mhm.
and it's coming through state funding. And, you know, we've already had that conversation at Tri-Town, like, if we didn't have this grant, we had to hire our own nurse, it'd be significant. And so, like, this is sort of like a reflection in kind of just what the relationship is, so we can continue to provide these grant-funded services to the towns.
They're already seeing the benefit.
If a select board doesn't want to sign an IMA, it's almost saying, okay, well, you don't want free nursing services then.
Mhm.
That's an easy
Yeah.
sale.
Yeah, that's an easy sale, exactly, yes.
Well, but the challenge with that, in some cases, I'm not sure if that's a challenge here, is that the select board likes to say, okay, we're getting free nurses, then why do we need to pay a nurse? Why do we have to pay our own nurse?
Yeah.
And that is specifically prohibited
Yeah.
by this
Yeah.
grant.
Right,
This grant and this whole special commission report, the whole, the premise upon which all of this has been built is that we want to augment services provided by a municipality, not supplant. And if supplanting is happening, that is a red flag that will go off, and that's when funds can be withdrawn.
We spoke about that already. So for example, when we first crafted this program, a lot of the small towns had an existing VNA contract for public health, limited at best, but like the money was there. And then out of nowhere, the VNA canceled the contract, said we're not funding it anymore. So some of these towns have like they have a line on that was already approved at town meeting, and I'm already working with like Otis and Monterey and even Tri-Town to see if we could utilize that,
Right.
sign a separate contract, figure out a fair share cost.
Right.
Because we just bought medical refrigerators to kind of, or put it back into your own town for training or a food
Right,
inspector.
right.
As
You
long
don't
as you're
want to
putting
wait,
it-
you don't want to
it-
give it up.
So it's more like, you know, we're looking at a significant upfront cost for vaccine at some
Right.
point.
Right.
And we'll figure, but if a town doesn't want to help pay for that vaccine, they can put it towards their own town.
Right, as
And so-
long as it's used for public health. right?
Yeah, and that's sort of like, hey, you know, training for inspector, going to the MHOA conference. And so it's
Right.
really kind of open to whatever the collaborator is looking for. But for example, Tri-Town actually funded, just Tri-Town before the grant came in place. We actually funded a significant line item for public health nursing without knowing the grant was coming. That got approved at town meeting. Well, now we're level funding that for fiscal 23, and we're going to use that funding for our purchase for vaccine.
Right.
When we tell the towns, you don't fund this line item, it's going to compromise A, the grant, and B, that could compromise the entirety of what we're trying to do. So you have to kind of go in this and at least level fund that
Right.
existing resources, so and use it for whatever.
Right, and that should happen annually.
Yeah.
Right.
It should be level funded, or whatever, it should, there should be money, and at one point, there was a thought, and this might happen down the road, because I see local public health changing exponentially in the future, but there may be a requirement of matching funds at one point from a municipality for money coming down the road that might go directly to municipalities. There may be cases where that happens, or money may be going to collaboratives through a budget line item instead of through grants. And that may be something in the future that the legislature looks at, requiring matching funds.
I would probably say not talk about that right now to the select boards.
Oh, no. That's when the millions of dollars start coming in. That's not gonna happen for years. But that's really when we're talking
Yeah.
about budgets that are gonna look, and public health that's gonna look a lot different with foundational public health services. That's not gonna happen
Yeah.
now.
Sure, do you see like a long-term vision of maybe giving municipalities like per capita dollars to add and beef up?
What I see in the future is more resources going into local public health. I don't know how how it will shake itself out. I think a lot depends upon on the success of these collaboratives.
Yeah.
But it is certainly something that the legislature is looking to because of what we've been through for this past almost 2 years.
One more comment on the select board issue, getting them to sign, having a separate sign in a municipal agreement. One of the questions was around, well, is this money going to disappear? So that's just a good point to use, or my understanding is there's like really about 10 years worth of it.
12 right now, well, theoretically.
Theoretically.
Subject to appropriation.
Subject to appropriation, but the appropriation,
Is something to talk to our state reps about.
yeah, and they are really behind this program.
Yeah, so I mean, those are just all, okay. so
And it's
not
always subject to
guaranteed.
appropriation. I mean, my job is subject to appropriation. It has been for
Mine is
25 years.
Well, all of ours
All
are
of
with the
us.
regular town. We don't know 2 years from now that Lee's gonna put their appropriation to Tri-Town, then it all comes crashing down. It's sort of like, I try not to put myself that far ahead. It's sort of like, because there's a lot of
Working on a
unknowns.
week and a half.
There's a lot of unknowns out there, and you don't want to make decisions on unknowns.
Right, but my point is there's some anticipated and thought of structure that's beyond 1 year.
Yes,
in
Yeah,
terms of
yeah,
things,
yes.
And that's a strong point to make.
Yes,
Absolutely.
yes.
absolutely. Withdrawal, I know this is an issue for some collaboratives, and this is a very liberal withdrawal policy here. 3 months written notice to withdraw. And I think the reason it's so liberal is that you're not putting any of your own funds into this. You're not, a lot of IMAs have a year's notice. And I think that's probably because they're larger and they require funding from town meeting for each municipality. And it may be harder to fiscally account for someone leaving, a town leaving. But in this case, it really isn't, because the towns aren't putting any of their money into this. So getting out of it just, it gives more money to the collaborative, so it wouldn't be a huge lift for a municipality to leave. This agreement can be terminated again by the advisory board. It's by a vote of a majority, not unanimous, but a majority. And it has to be done at a meeting that's called for that specific purpose. And it's not effective for at least 60 days, so that you can get all your ducks in a row, your contracts resolved, and so forth, and so on. But there is a process for terminating the collaborative. So the current scope of services, and I think I got this right, you can tell me if I didn't, that the public health nursing services are being developed now, that agreement, or will be being developed. And you also are going to be looking at a part-time shared services coordinator that will be responsible for doing the contract deliverables that DPH requires. The quarterly reports, the work plan, and the budgeting reports that need to go to DPH. That is a strong recommendation by the Department of Public Health, that you have someone whose only task is to basically do the paperwork. And they suggest writing that person in. So I don't know if that's something you're doing now, Jim.
So, yeah, I mean, I have the shared services coordinator on the agenda today after this presentation to
Oh.
talk about that.
Okay, to talk about that. Okay, so that should also be under consideration in red on this. Whether that's something you want to do or not. So, and inspector services, I think that's something that you're considering at one point.
Yeah, I mean, it's not, we haven't formally talked about it, sort of like just
Okay.
as we evolve.
So
over time.
I will add, under consideration for the part-time shared service coordinator and also for the health inspector. They're both just in the future. Something that you're thinking of.
Well, the shared services coordinator hopefully will be resolved today.
Okay, all right,
So it may
so,
not be under consideration after this meeting.
okay, okay,
Right.
So change it now on your,
Quick, it may have a short life.
So
okay.
Jim, the shared service coordinator would be dealing with the public health program at this point.
Well, so I mean, I can get, let's let Cheryl.
I think I'm done. That's it.
And
That
so
was-
I'll get into that and I'll explain everything that's
That's
going
my
on.
last slide. The next is
Nice.
questions and discussion. Which we-
Jim, I had a question.
Sure, go ahead, Brandy.
So because we're gonna need town meeting approval because of the length of this contract, are we looking at May for all the towns to be signing this?
So Cheryl, would we need town meeting approval? Is this a meeting of the select board that would sign the IMA?
It would just be the select board that would sign the IMA.
So it wouldn't be
So I
town
like
meeting,
this one.
Brandy, it'd be just the select board.
It's done.
Right, but we can't sign an agreement that's longer than 3 years without town meeting approval. Generally, most of our contracts we sign are 3 years or less.
But it's not a contract though, right? It's an
It's an
agreement.
agreement.
Okay.
I understand what you're saying. We will look into that, but I don't think, that has never been an issue with
Okay.
signing agreements pursuant to chapter 40, section 4A.
Okay,
Rich, you heard that, right?
Well, and I can answer too, because Tri-Town just updated their IMA, because Tri-Town is a formal district, but we've been around for so long. It was easier for us to do 40, section 4A.
Yeah.
And we did that. The Board of Health approved it. Then it went right to the select board at a regular selectmen's meeting and everyone approved it.
Yeah,
and ours was done through the select board.
Yeah.
with the other.
Rich,
Yeah.
Rich, can you just jump in here for a sec?
yeah, I can. Hi, everyone. I think you're right. I don't think it needs town meeting approval based on the way it's drafted. It's not necessarily a contract for services over 3 years, so I think you're fine. I'll certainly look into it in that issue and get you a good answer so that you can take back to your communities. But that's my understanding.
Yeah, and there's no, I don't think there's anywhere in chapter 40, section 4A that states that, but we will confirm that, Brandy.
Well,
okay, thank you.
Another example is if you sign a public health nursing contract that's subject to town meeting appropriation, that has to be 1 year because it's subject, you have to do that every single year. And since this IMA doesn't include any taxpayer,
money.
well, it's dollars coming from somewhere, but not from town, not from the town. It shouldn't, Brandy, be required to be signed off by town meeting because it's not subject to the town meeting appropriation every year. It's just an agreement.
Okay.
It's excellent question. Yeah.
Okay, I'm done. Questions?
Thank you. That-
Open it up.
Not a problem. And again, this is a draft. You know, your town attorneys will probably, hopefully, look at this. And they may have other suggestions that we can certainly add or subtract. That's the way these things go, but this is a draft that hopefully captures your intent. And then we can take it further from there.
I do have a navigation question, like once we start to advance this intermunicipal agreement. I see it's like, it's got every single town on one document. Do you have any thoughts or ideas about just, so if Sheffield does it, we have to wait for Sheffield to sign and then come to the next town and the next town's got to do it.
Oh, I mean, we can, and correct me if I'm wrong, Rich, but that's just a process issue.
Yeah,
We can, you can have more than one original document
Okay.
that you bring, and the signature pages can be attached
okay.
separately, so you're not stuck with
That would be awful.
that. Yeah, that just wouldn't work. I mean, and you don't have to, I mean, all you need is the signature. You need to know that the town signed the agreement, so it can be signed on a different. piece
Yeah,
of paper.
because it's come up in the past that folks have made comments where like, it's impossible to change an IMA because it would take me forever to get 15 towns to make a decision on this. I just want to make sure it's just easy for everybody.
Right,
They
and
sign
and
their
we, and
agreements.
again, part of this, MAHB can do part of this. I know way back when with the district incentive grants, 15 years ago, we can go to select board meetings as well and help explain this if that's necessary. So I don't think it should be as heavy a lift as some people seem to think it is. You could, a member of, or a potential member of the advisory board can go to a board of selectmen meeting and present this and get approval, or get signatures at that time.
Yeah.
I mean, there are ways, we can figure that out. That's just a process issue.
Yeah, you can use the presentation as part
Yeah.
of the IMA presentation. And I'm wondering if the board's interested in maybe having like a short bullet point, kind of like summary of what it is, in case like questions like this come up at a meeting.
Ellie?
I have a question again on process and what our timeline should be. I was, after reading this, what we got on, in our email, I printed these out for our board meeting tonight to get them to start thinking about this.
Great.
But one of the questions that I'm going to have given to me is what is our timeline for acceptance on this?
Good question.
We're looking at starting our financials, as small as they are in Mount Washington, in 8 weeks.
Yeah.
So if we don't kind of get this going, we're looking at a delay of yet another fiscal year to kind of move things forward for our finance committee. We just have a lot of.
But this doesn't affect your finance committee because you're not.
Well, it won't, except that in our town, the finance committee is brought into all of these discussions and you have 7 more people.
No, I get that, yeah.
So no, they don't have to approve it, absolutely, but the select board, in all fairness to them, really is adamant about everybody understanding what's going on, which is appropriate. It's not always convenient, but it's appropriate.
Right, no, absolutely.
I mean, I think timeline is, once this advisory board approves the draft per se, you advance it.
And then advance it, okay.
Yeah, we
And
just,
then just start
So we could really
working
be
it.
looking at maybe January
It-
or so to start putting this out. to
I mean-
the select
I
board.
mean, our next meeting is, our next meeting is a month from now.
Right.
Right,
But if this advisory, I mean, I think everyone should take it home, read it. If there's questions, let's ask Rich, Mike, and Cheryl to help facilitate any concerns, and then bring it to a formal vote, then go for it.
right,
Yeah,
and
it's-
that, oh, sorry, I just, what I would really like to have at that point is that our advisory board put together, you were talking about a bullet point. I
Yeah.
don't think the summary is all of that important.
Yeah.
But something in a focus to why should we accept this? Making it I think having members of the advisory board going to a meeting remotely or whatever would be very, very helpful.
Mhm.
But also,
And we
so
are
that the
also-
board feels comfortable.
We are also available to go to meetings, virtually or in person.
We take
Preferably
it
virtually,
virtually for you.
but
Yeah.
preferably virtually, but you can also.
It seems to me one of the first things we need to do is get this to our town attorneys, because they're all gonna flake out over it.
You would think.
Yeah.
Well, once they realize it's free money and I'm saying that
Yeah.
facetiously, but you know what, it's
Right.
not coming out of a town budget.
Right.
Well,
Right,
and there's
but
not a lot of onerous things in there, like,
No,
like it says, the term is once the money's gone, then the town's no longer beholden. So that's different than like what may have been in the past. So there's not like a huge long-term, non-funded
But we all
mandate
know
that-
our legal counsel is gonna wanna chew
Oh,
it up.
Right,
Right.
but in our town, at least, our select board has to give permission for us to send this.
correct.
So now you're talking yet another couple of months.
It's gonna
for-
take a while.
It'll take, I'm just saying, I mean, I'm ready to go with this tonight and say, hey, guys, here you go.
But depending on your town,
But-
because I've experienced with
That's
this,
not gonna happen. right?
sometimes what you do is you present it to the, so some boards of health don't have direct access to their town council, and yet some do, because it's billable hours. But sometimes I think if you present it to the select board, they'll take it under consideration, refer it to town council.
Right.
Right.
So that's
Right.
sort of like the mechanism there, just getting it
Get
on the
started.
select board
Right.
agenda, present it and say, have your town council
Right.
scrub this. And then I would definitely link Cheryl, Mike and Rich up
Up
with
with
that to help.
Absolutely, and I think
facilitate that.
that's why we want to move it forward
Yep.
sooner rather than later for a presentation to the select board. I guess that's.
Right,
where
and I guess,
circling
I don't know
around.
how many of you use KP Law.
We do.
Yeah.
They've already looked at this,
Yeah,
and they've already added some language to it that we've incorporated into it.
And that's
What's
good to
KP
know.
law?
It's
It
just
used to be
It's a
top
law
of the
firm
page.
that represents
Uh,
probably a third or a half of the municipal.
So question on, so if the town council looks at it, they want to make changes, I mean.
That's fine.
That's
but the
fine.
whole Group has to agree to those changes.
Correct.
This can't be on-
Correct.
So,
No.
so we'll track the amendments, Scott. If there's town council questions and say, hey, here's Cheryl's.
Yeah.
I hate to put everyone on the spot, but like we can help do that with tobacco all the time,
All the
right?
time.
Town council starts to chew up our tobacco regs. We're like, hey, let's talk to DJ Cheryl to help facilitate that. And we'll collect all the amendments. And if it requires another vote, this is gonna take more than a couple months. This process is gonna take a little bit. As long as we're moving towards that, I think
Right.
it's fine. But everyone wants to be satisfied and happy.
So just, sort of.
Not
Lots of luck with that.
Simple, if a town doesn't sign up,
Good question.
then they don't get the vote, they don't get the service.
Correct.
Right,
Yeah,
right.
okay. So, I mean,
Yeah.
that's-
And better start budgeting for a public health nurse for FY
I
'23.
mean, that's just the point today, too.
Right.
You're not
Right.
gonna force a select board's hand, but to
No.
make a point.
But there's a
Don't be
Well,
result.
not where
stupid.
anybody
Be
can
stupid not
see
to.
it.
I can give you a baseline nurse rate and how many hours they put into your town, and you can crunch the numbers and
Yeah.
go for it. It's expensive.
Yeah, well, I mean, that's not, that's actually a useful thing to have and say, look, you don't want to sign this, it's gonna cost the town $24,000 minimum, whatever the number. Just to
Yeah.
understand there's a real thing here. And they may say, well, we'll just go back to the way it was and not do anything virtually, anything.
I have two more questions.
Sure.
So, and for Cheryl, so for those of the towns that are in the Public Health Alliance agreement as well, are there implications of that? Or
That-
to be in both or not, or how should that pan out? in the future?
That is a good question. My understanding from looking at the Alliance IMA is that it is not exclusive either. Which means, again, that you can determine how you are going to get the delivery of public health services whatever way you want. So if you, well,
Okay.
having said that, so
The
that
basis
you,
of my question is in the short term, that we're not doing something illegal.
you're not.
And then-
Because they're both not
To be in both.
exclusive agreements. They both say you're picking and choosing how you want to get your services delivered. So no,
So it's not a have to get out to get into this
No.
one.
the,
Everything's going to figure it out.
not at all. And moving forward is another issue. In the long term, if you want to alter your agreement with the Alliance, you've got to do it pursuant to that
Yeah.
IMA,
Yeah.
okay? And if you want to alter it with this collaborative, then you do it pursuant to that IMA. So,
Cheryl, you mentioned attending meetings virtually. As I understand it, that option from the state is now off the table.
that's another thing to look into. It's not completely off the table, and it depends on what kind of meeting you're talking about. As long, my understanding, and I will confirm this, but as long as the public has access to the meeting, you can still meet virtually, unless there's a local decision that you can't. Because some local boards, municipal boards, they're being instructed that by their town manager that they have to meet in person. We can look into that though. Rich, can you, I just don't remember, I know that the emergency order was lifted at the end of May, but I don't think it affected the ability to hold virtual
I
meetings.
think
It's
it
through
went for a couple
April.
weeks or something, and then
Well,
there
they-
was another
Right.
act that came through or something.
Well, what happened when the governor issued his, when the governor rescinded his emergency order, he put another order in place that permitted the Department of Public Health to continue to act on COVID because there was still a state of emergency. It was still not a declared state of emergency, but there were still emergency actions that may need to be taken. And I think that sort of resolved, and right now, I can't imagine with what we're seeing coming down the road, there'd be any problem with holding meetings virtually.
It
for
would be
the
really good
foreseeable.
to get a ruling on that. though.
We can, Rich, put that on your list, please.
Yeah, no, I can speak to that a little bit right now. So the order's been extended to April 2022. And so Cheryl's correct. As long as the public has access, you can do that. But a local order can trump that. So if the town specifically votes otherwise, they can do it.
All public meetings, that's what I thought, okay.
Yeah, and I was gonna jump in. It is April. It's
It's
still
April,
in the
okay.
disclaimer.
So so Rich just clarified it's
Right.
until April. And I can't imagine it not being extended past that too.
And
But then if
I
you-
would, I would strongly suggest that we lobby our local representatives to make sure that that gets to be permanent.
Absolutely, well, and
we have.
that's, I think there have been bills filed to that extent, because it really has made.
Life a lot easier.
Well, yeah.
Yeah,
And we have lobbied Ellie to Smitty and others on that.
Especially like, I think Berkshire's, we've been able to participate in bigger conversations that would have been very difficult for us to be at. So it's been really good for the Berkshires, I think.
I don't know if folks remember that there was a time where we didn't have COVID. And during that time, I call that BC when I date things. So around 2 years BC, there was an amendment in the open meeting law that allowed individual municipalities to decide whether or not they would allow remote participation in meetings. And that was because board members were traveling and they wanted to be able to call in. That was before BZ, before Zoom. And so if you remember, we used to have something called a telephone that we used to call in on, and there was a speakerphone in the middle of the room. And I think that went the way of the dinosaurs. I'm not sure. But there is law that says that under the open meeting law that your town can adopt a remote policy, and it lays out the same roll call votes and all of that as part of it. And it would allow each town to either opt in or out of being able to do that. So if we ever do return to normal, which as of this morning's news, I'm not sure we ever will. But if we do, keep that in mind, that there was law back in the year 2 BC or 3 BC.
And Cheryl and everyone, if I could just add just about the process, the document, the way it's drafted now, has all those signature pages on one page continuously. The agreement actually can be signed in what we call counterparts. And so what we would do is just separate out each town's signature page and have that done just for ease, so that we're not passing around all over Berkshire County, this agreement. So.
Cool.
Absolutely, we can do all that. And again, I'm here to assist in any questions that your legal counsel has through Cheryl. We're here to help in any way that you need and assist in the process. So happy to help out.
Terrific.
Thanks, Rich and Mike.
Okay, shall we proceed in the agenda?
Thank you, Cheryl. Yes.
Thank you so
Madam
much.
Chair.
Thank you.
Short, do you want to, can they sign off or do you want them? to
Oh,
stay?
no, unless you're bored, you can hang out.
No, actually, I want to hang in while you talk about the grant administrator role, because I think I might be able to help there since I have been a
Yeah,
grant
that's a good
administrator
idea,
since it
Mike.
began. Right.
I'm gonna sign off, but.
Okay.
Cheryl
Thanks,
will-
Rich.
Thanks,
Thank
Rich.
you.
Thank you.
Okay. FDA update, that's where it's at now.
Okay, so we were able to get in, if you'll remember, we were gonna do one big grant application. We ended up doing 3 individual, which ended up really being 6 individual grant applications to FDA. And the highlights, I can send this out. I should have sent it out earlier, but the highlights is that we are going to be going through all of the boards of health, working with the boards of health, looking at their forms, looking at their like inter-office systems and suggesting changes to that so that it meets the standards, the FDA standards. So as a group, that's kind of what we're going to be doing with all of the boards of health. Sheffield and New Marlborough are a little different because they're going to have additional support for their food inspection program. And so we're going to do what's called a risk assessment study. And through that mechanism of doing the risk assessment study, we're going to do really thorough inspections. When I say we, I mean that they got the money and they can choose a vendor or who's going to be doing that. That can be someone training their inspectors. That could be there's some resources available for us to be facilitate that. And so it will be a net win for the towns because it will give them $5,000 to have someone go out and do that. Sheffield is getting a little bit more administrative support. New Marlborough is getting some training for their existing inspectors. So that's how we did it. And then the third one was through Tri-Town Health Department, and that's the one that kind of overreaches all 10 towns. And the goal is to just get us up on level footing, and it will give us resources for the through the collaborative staff to go to the individual, do some trainings with not just the boards of health, with this group and with industry. So that will help pay for that. If we have forms that need to be purchased, that grant will pay for that as well. So, and then there's some training grant that was applied for. So in all, I think it ended up being about $45,000 total that we applied for. And we should be getting that word on that in January, and then those services start in February. So this money is exciting money. Any town that wants to improve their food system, this money is going to continue to be around. And I think this will get us a good foundation so that we can talk about next year what we want to do, whether we want the money to go to the individual towns, which I think there is some benefit to that. Or do we want it, we won't be able to now apply for the $100,000 grant for another 3 years. We gave that opportunity up, but that's okay, because that will give us an opportunity to really decide what we want to do in Southern Berkshire County, so that when we do put in that grant, that will be a strong grant, and that all of the members that choose to sign on to that grant really understand what their goals are and are committed. So I actually is fine that we have now 3 years to kind of decide what we want our food program to look like in Southern Berkshire County. So.
Thank you, Jane. Are there questions for her?
I mean, I have more comments than questions, but I thank you so much for doing all that. I know it was very complicated for you to sort all that out. Because like if you were to do like one collaborative grant, it would have been really easy, but we had to like tease it apart. But that's okay, because we're gaining our footing. We're sort of learning about each other and how to support each other. What I really like about the way this collaborative is structured, it's like Cheryl used the term not exclusive, it's not exclusive. you know, if we get grant funding, it's gonna be a direct benefit for the town. That this is not money that's gonna funnel into Tri-Town to build Tri-Town's workforce. This is for you in the collaborative. And so if Sheffield wants their money to hire their own food inspector, we're gonna support that. If towns get their own funding and they want to pull it to like a shared pooled inspector, that'll be a decision of the advisory board. There's a lot of flexibility in how we're growing this collaborative, and so we're not pigeonholed into one way of doing business. The goal is to really build each other up together over a longer period of time. Because as the money's coming in future-wise, and if the stronger we become as a collaborative, the more opportunity is going to come down the pike. And we have a really good opportunity to really change public health in Berkshire County for the good. And so I just feel like, I feel really excited to be at the table, but I know there was a lot of work for you to bang that out with multiple different ways, but so I thank you for that, and
You're
I'm
welcome.
looking forward to it.
Okay, I just would like to have us be mindful of the time. There is another meeting at 11. if
Okay.
We can get done with this one. Jane, also on the listserv conversation, I'm not sure what that is.
Oh, yeah. So last month, we had talked about possibly having a listserv. So what a listserv is that people can ask questions and answer. So it's more of it ends up being a dialogue. Google has one. You can sign up that once a week you want there to be an email to you. You can have it be that every time that someone mentions has a problem or a question that immediately goes to your email. So there's a couple different ways of doing that. You know, I think that might be really nice to be able to throw out questions and have a mechanism for conversation. And then when I was talking to Jim about it, the other thing that happened was that, you know, maybe a Dropbox account or a Google Drive. We all have resources, right, that we have, but I have a file that has every single digital file, has every single subject. It's got the regulations, what other towns have been using for their applications, what inspection forms are being used, and maybe that would be a really interesting way for us to share, so, like, if we have white papers or so that way, like if Rebecca had a question about fees, she could look under fees and see what other towns have been doing. So, and that would even that would provide support, but eliminate some of the chatter in our inboxes, but still allow us to kind of build our program together. So the thought is initially it would be pre-populated with what's existing, and then as a collaborative, we can just add things to it. I think it really could benefit all of us. So.
Discussion?
It certainly would cut down on the amount of time it takes to look up everybody's stuff, which we've certainly been trying desperately to do with a lot of issues lately. So, yeah, I think it would be, I think we need to do anything we can to allow people to handle stuff when they need to handle it, and not be waiting for return phone calls, not be, you know, just, so I think it'd be a great idea.
I'm supportive of a shared file system as opposed to something being sent to our emails, or because it can get lost in the shuffle, and you know, then you're searching months, years back. So having a shared file system sounds the most organized way of having that information available.
What do you guys think about in the shared filing system, having a Word document where someone can ask a question or put like something in there, and it could be like a living document too? So
I think that's a different purpose than a shared system for access to resources that are there. I mean, to use it as a conversation method, I think it's a little confusing.
okay,
But a listserv, I think would be, to complement the files, a listserv with the group as members and being able, as you said, I now remember the conversation last month of asking questions, getting advice, being referred to that file would be a nice dual asset for the collaborative.
I think file sharing is a good start. we gotta be careful too, when we start getting into conversations that, could be
Yeah.
subject
Yeah,
to
that was
open
exactly what I
meeting
was-
and all that stuff too, so.
Okay, so
What,
maybe.
what
just the
becomes
phone.
part of the public record? That is tricky and always manages to seem to come back.
Point then. Okay, so the idea of a shared, access to a shared file with core documents, that are either local or state or whatever, on Jane's organization.
Okay, great.
Great, thank you. Give it
You're
a
welcome.
try.
I think if there
Shared-
happened to be, just one quick thing,
Mhm.
if there happened to be a really educational or beneficial email exchange or listserv exchange, that could always be then shared to or added to the shared files.
Right.
Yeah.
So,
And we already have like emails that we all have each other's emails, so it's not like there's a huge group that the only way we could really easily access it is through a listserv email.
Yeah.
Okay, great.
Shared services.
Yeah, so Madam Chair, if you don't mind, what I'd like to do is, I know we're starting to creep up on where we need to. I'm just gonna kind of go through my quick updates and just turn it over to Jill, and maybe that's
Okay.
maybe more efficient way to get through the meeting.
Okay.
So shared services coordinator, so where we're at is, we created a job description. It's sort of a little bit of a hybrid position, because we know that there's only certain dollars left in the shared services budget. It's really about 10 hours. It's not a lot. And so the budget itself is completely maxed out. 90% of the shared services grant is dedicated to the nurses and staffing, salaries, a little bit of mileage. But we did carve out a very little piece in there at the beginning for a shared services coordinator. But it's by itself, it's not a lot of dollars, right? So it's, how can you hire someone for 10 hours
Per week.
limited? Yeah, 10 hours per week limited, based on a competitive salary to actually do this. It's almost impossible to do. And it's been on the budget since the beginning, and it hasn't been filled, and we're trying to sort all that out. And so on top of that, what Tri-Town has done outside of the collaborative is we've actually secured $70,000 in ARPA funding for the 3 towns for the next 3 years, because the boards of health are super committed to really moving the FDA retail food standards around. So when I look at that dollar amount and then combine that with the shared services, we're able to, I don't want to use the word cobble up, but it's sort of like we did. We were able to cobble up a full-time position, and 10 of those hours would be dedicated to the shared services program, because benefits is not a cheap cost. It's pretty significant when you look at a shared services coordinator that's going to be working 30 hours a week and getting benefits. It's quite significant. And so what we've done is we've crafted a job description, and Pat and Rebecca, we shared that together, a couple months ago. The position was posted. So it's got some shared service deliverables in the job description, but there's also some Tri-Town work that's going to be done. And so that position has been posted, and one person applied that was qualified and that was Jane Smith, and she interviewed for the position. And so getting to Cheryl's point that even though 2/3 of the workload right now will be dedicated to Tri-Town, the other 1/3 will be dedicated to shared services. And so I would like to bring that applicant forward and see if there's any objections to offering Jane the position. Although she's sort of been offered a position through the Tri-Town piece anyway, but I want this board to have an opportunity to voice a yay or nay to provide Jane that job, and with hopes that she'll start in January. And the long-term goal is to really wean off the Tri-Town piece, because there's a lot of irons in the fire right now that's going on. We just wrote a vaccine equity grant with Fairview. We have a new relationship with River Street Youth Project, which can bring in some additional funds. And as the FDA money comes rolling in for Tri-Town, we'll be able to do that. So I really envision the 10-hour piece of the shared services to really start to evolve and put more hours in, even though it's outside of the dollar amount for the shared services. And maybe we get more money from the state to increase our budget that can be a full-time shared services in the future. So that's where we're at.
I just want to be sure Ellie, because she raised the question, is comfortable with this notion. In which you were out for that basic discussion, the fact that it will be a full-time position, 10 hours of which in a week will be devoted to shared services, the rest to Tri-Town.
Yep.
And Jane has been proposed for the position.
Yeah, thank you.
Okay.
And I can leave if that would be more comfortable for you guys to have a conversation. Someone would just have to take notes.
I'm not,
Don't
I
think
mean,
feeling that is necessary. Thank you, though, Jane.
And I'm gonna abstain from this conversation.
yeah, into, you know, and I know Cheryl, I know Mike was asking questions too, and you know, at the end of the day, I mean, there's still a responsibility for me as the program manager, because I handle all the finances for the district, for Tri-Town. You know, I'm bonded and all the other stuff. So like, Jane's, you know, if there's no objections, obviously, she's going to help me like do the agendas, the minutes, help the nurses, help with the IMA process. And, you know, so we'll be working together because there's not a lot of hours right now. I mean, the quarterly report financials is a little bit of, but like I have to do that because I handle all the finances, and like trying to give that to somebody. It's really to support the nurses and move this collaborative along. I'm not going anywhere. I'm still going to be here to help support. And hopefully over a longer period of time, this turns into a full-time 100% shared services coordinator, because I really feel like we're really evolving and we're going to grow over time. But it's really difficult within the confines of the current grant budget right now.
Is there any further discussion on this? If not, I would entertain a motion to hire Jane. Ellie moved. Was that a second? I don't know.
It was a
It was
second.
a second.
A second, good. Any discussion on the motion? All those in favor? Aye.
Aye.
Opposed, abstaining?
I'm
One abstention?
You're opposing?
Yes.
abstaining.
Oh, I thought you opposed.
Great.
All right, so,
Thank you.
okay, thank you, everyone. So I really appreciate everyone's support on that. I'm really looking forward to trying to get back to some of my other work.
I'm going to duck out at this point, and thank you so much, everybody. And you just made a great choice. Let me tell you, Jane knows this program backwards and forwards, and has been really a good advocate for you guys. So thank you. I'm out. Cheryl, we'll see you when you get back east.
Thank you so much.
All right, bye.
And I'll really briefly kind of end, and so, you know, we have the Rural Vaccine Equity Collaborative Grant I briefly mentioned. We have the Railroad Street Youth Collaboration, and I'll update Mass in Motion. One of the things that I'm really enjoying as this collaborative is growing is that we're picking up a lot of momentum, the collaborative itself. There are organizations that I've always had relationships with. They're actually reaching out to us now to partner with them. Fairview reached out to us, and Amy and Deb Phillips put together this really comprehensive vaccine equity grant that's been submitted. Railroad Street Youth Project reached out to Jane and I. They want us to help do a bunch of South County things. So I really feel like we're picking up a lot of momentum rather than us kind of rebuild. People are like reaching out to us because they see what we're doing. So that's really good.
You just need to be sure you keep the board.
Oh, we are, yeah,
engaged.
yeah. And and that's, I'm putting that on the agendas and whatnot. And so that's, it's becoming exciting. And the weekly dashboard that Amy puts out is picking up a lot of steam. We get about 900 likes a week on one post, and
Yeah.
it's picking up a lot of steam.
And she did a great job on the radio the other day.
Yep.
Yeah.
Yeah, and Mass in Motion, for those, I think we did discuss it, because we do have a new mechanism now, by the way, with Pat and Rebecca working with the Alliance on a monthly cycle to try to get on the same page and communicate and whatnot. And so Tri-Town has been a long time the fiscal host for the Mass in Motion program. You know, we're actually going to give that away to Northern Berkshire Community Coalition. It's just one of those things where there's only so much I can do, and I'm really trying to put a lot of my cards on the table with the Southern Berkshire Collaborative. And while it breaks my heart a little bit of giving up the Mass in Motion grant, because we kind of built that from the ground up for the last 12 years, we're really giving it to a very good organization that's going to continue to carry the torch. And we're still going to be involved because it includes, I think, Sheffield now, Great Barrington still, Tri-Town, a few other towns, and we'll work on that. And the last piece is, we met with our John Kroll, our logo developer, the other day. We have a pretty good shell of what we're thinking about of a logo. And we're gonna reconvene in a couple weeks on the 20th to kind of look at that in hopes to present two good, solid ideas for the advisory board
Next
to
meeting, right.
next meeting. And then the survey, so DPH has sent out this survey. It's really leaned towards workforce development, and they're only asking for one response. So I've asked the towns, if you have your annual report, either give it to me, or if you want to fill this out and send it to me, it's due next Friday. It's like, how many perks do you do? How many Title V's do you do? And I think it's really meant to kind of gauge the needs of collaboratives and training needs and whatnot. So I don't want to take a stab at what New Marlboro, I think New Marlboro does. It'd just be helpful. Great. It'd just be helpful if you could just fill this out, guesstimate, get it back to me. I'll add it to the totality and send it in. That's all I have.
And it seems like they're trying to do calendar year 2019 for a baseline and not COVID. Is that right?
Yeah.
Did you send us a different thing to put out? Because what I got, I just sent you our annual report.
I'll deal with your annual report, but
Right.
for those that didn't send me one,
But
I know.
we don't have that information in our annual report, so.
Yeah,
Well,
we
it's
don't
okay.
either.
If you can, if you don't have the information, tell me how many perks you think you do a year and how many times. I have Otis, Monterey's information. I have Tri-Towns, and I may have a couple others, and I'll try to crunch all those numbers in. It doesn't have to be perfect. It's really just a feel of what the needs are in the area. That's all I have.
I got a quick question, sorry, somewhat belabored, but to the IMA, the shared services coordinator, in that moving forward, there was made a comment earlier when going to the IMA that there'd be no services under the IMA.
No, there's no fee for services under the
So-
IMA.
So as we expand those other services, then it would all come from grant money.
Probably, yeah,
Like,
yeah.
in order to do that, we'd have to then apply for those grant, like.
I think I understand what you're saying is that the scope of this IMA is small. And so if we expanded into having a shared services
To help with
inspector,
food, yeah. food
then
and
that would be as
stuff.
part of the appendix and that would be determined later, but
But there's no
really,
mechanism to then have a town pay.
No,
No,
it has to
no.
amend the IMA.
No.
Yeah, no,
Yeah, so whatever the scope of the IMA is, it's not gonna come at town meeting appropriations.
Yeah.
It's all grants and stuff. Now, the side conversations we're having with some of the smaller towns and hope to utilize some of the VNA money is not part of the IMA. It's a separate conversation that would be a separate contract.
but if he wanted, if New Marlboro wanted to have help with septic or something,
Yeah.
what would be the mechanism
Yeah.
for the share, for our group to help if we ended up having a shared inspector? I think that's-
Sure, we would figure out where the resources are coming from, if we can't,
license fees.
if it, say DPH gives us an extra $75,000 in there, we do a budget amendment to allow a shared inspector. What we would do if this board is agreeable to having a shared inspector, we would amend the appendix to say we would have a shared inspector. We wouldn't go to the town of New Marlboro and say, oh, you need to give us X dollars for an inspector.
Right.
Unless you wanted to
Right.
unless you want to give money away.
No, but I mean, but it sounds like it wouldn't be done under the agreement that you just hire a tri-town.
Oh,
inspector.
well, you could, sure, it'd be a separate
Outside.
contract, yeah.
Yeah, okay.
If New Marlboro wanted someone to do your Title V inspections, I think that it's similar, if I'm not mistaken, Cheryl, it's like sort of like trying to capture the VNA money. I would have a
Yeah,
signed
that wouldn't
agreement
be
with,
part of the IMA though.
Right.
it would be.
It would not be.
No, it would be. That's the point I'm trying to make. It would be outside of the scope of the
Correct.
IMA.
Right.
Correct. I mean, you could do it, hopefully DPH would amend the contract up and let you do it as part of the IMA.
Yes.
If they don't have what they will have, if they didn't have the resources to do it, then you could do it
Separately.
with a separate contract.
So
Yeah,
New
okay.
Marlboro could do a proposal contract to this group that they would pay a certain amount to have.
No, not
No.
pursuant, not pursuant to the IMA. the IMA is just, this IMA now is just designed for for gifts and grants. It's not designed, you could create another IMA in the future.
And you can't use well, it's a shared services grant. We're choosing to use it for public health nursing.
Yes.
Correct.
Right.
Oh, and that's the way the IMA is written now.
Right.
Yeah.
So when you
but
want to
it-
start using the collaborative for some other service, you'd have to get a grant for that.
Exactly.
Okay.
Exactly.
But could New Marlboro pay for it out of their existing budget?
It'd be separate out of the IMA.
It would be separate, it wouldn't be a
contract.
collaborative.
Be a
one-on-one.
So perfect. So not to belabor it, because I want to give Jill her platform.
Going forward, it's just important to understand.
Oh, yeah, absolutely. I see two paths of doing this. Say we get a bunch of money, where we get this massive FDA grant, right? Say we get $200,000 in FDA, and this board says, hey, let's create a shared service food inspector. We would amend the appendix to, because the IMA allows for that. But if that doesn't happen, Scott, you retire and say, I need someone to do perk tests. I'm gonna pay Tri-Town under a separate contract to provide me services for Title V, which would be subject to an annual contract for appropriation if you're using taxpayer dollars.
Okay.
Yeah.
Okay, thank you.
Wow,
Okay.
that's a lot.
Oh, where to start? Okay, so the contact tracing, as Amy mentioned,
Yes.
your last meeting, the state had rolled out a timeline of what contacting tracing was gonna look like going forward. So it was the make one call, they don't answer, leave a detailed message. So that's what we've been doing. Tuesday, they moved the timeline up from January to now, saying you don't have to basically do any contact tracing. So we follow up with school-age children, providing, services to the schools and support to them, because I can't tell you how many kids are testing positive, whether, I don't know if we have any in-school transmission, but definitely from Thanksgiving, we've seen positive pools in all the schools. So it's, and the contact tracing, the schools are doing that, but we don't have to follow the contacts, like Dave said, no, you don't have to do that anymore. So that's made life a lot easier. Now we just go in and just acknowledge all of the, like 19 and older people. And just like, I think I have 2 calls today for school age kids today. So it's a huge improvement. They announced last night, boosters approved for 16 to 17-year-olds. So hopefully gonna see those kids taking advantage of that. That will be great. I know there's a clinic Saturday down at Mount Everett, and I think there's one in Lear Lennox this weekend also. Well, the Lions is running one, Heather's running one. So hopefully kids will sign up for that.
And the
Can
Alliance
I
is
say
running one on the 20, what is the date of that?
18th.
The 18th,
18.
yeah, they're hosting a booster clinic up at BCC.
And just adding on to that, on this weekend's first appointments, that was set up as that was the
Second
second
dose.
booster, and so the first appointments are having a hard time. So if you get someone that calls in your town saying, I can't sign up for my first appointment, then the answer is just show up and they'll register you on the site.
And this is for the 5 to 11.
5 to 11-year-olds, yeah,
clinic.
yeah.
But there's
But
adult Moderna
boosters are-
boosters also
Yeah.
being provided.
Okay, so if someone's having a hard time registering their child or
Mhm.
for registering themselves as an adult for their first dose.
So
I think both,
Both
because
are
she set
having a
all of this
hard
up as
time.
second dose boosters. I got
I
a text last
see.
night about 10, because I've
Okay.
been online trying to help people figure out, because I go on, I'm like, fine, and
Yeah.
Yeah,
those first doses are having trouble.
But you could do that. You can show up to a 5 to 11
That's what they're
year old
saying.
clinic
Yeah.
and get any series or any,
Yeah.
wherever
Yeah,
you
first
not
are.
dose.
Johnson and Johnson.
For
So-
first dose.
And
Okay.
I spoke with Leslie Drager just because I do the vaccinating a lot. She said the one at BCC will be first, second booster,
Mhm.
even children.
yeah.
So it's not gonna be,
Everything.
It's
it's
gonna be
everything.
everything,
Okay.
yeah. And then I did hear from Mackinac, I haven't followed up with them, they are gonna be doing a clinic. So I'm gonna follow up with them and see if that's true. I guess it's 2 Wednesdays that they're gonna offer it. I don't know how that's gonna work, they don't have any staff unless they're having people come down from the hospital to help them. So that will that would be great if they're gonna offer that.
Will you let us know?
Yeah, I'll let you know.
And then if that's just for their patients or if it's an open clinic?
I'll let you know. I'll
Okay.
ask that. I'll call their office after I get done here. And then we finally got everything finished and submitted to the state immunization site for us to become vaccine provider. We're just waiting on that approval from them.
Yeah, we gotta find a second location too. We're working on that. And I did forget to talk about the contact tracer update. So the DPH, St. Long had a few days ago, had offered us some additional resources with the intent to help Amy and Jill, because they're completely getting swamped, working weekends, and I get worried that they're burning out. So they gave us some resources and hopes. So I actually posted and quickly created a job description for a contact tracer. And then the DPH changed the contact tracing thing. So Sam came back to me and said, you're not on the hook to actually pay a contact tracer if you don't want to. You're getting the money to help the collaborative and whatever. So the team and I met yesterday, and we're going to designate Jane. I was hoping that the board was okay with that position, and she'll be the designated third backup to help Amy and Jill do any contact tracing that may come whatsoever. So I will be sending out another letter of asking towns to give Jane permission to access the Maven account. Just give me like a week or so on that. And so we'll put that pool of dollars towards the shared services coordinator to make sure that she's helping Amy and Jill out. So that's sort of like how quickly
it's
things are
rolled, right.
moving.
Rebecca had a question.
It's just a comment. And I know we're coming down to the wire, so I'll try not to go on and on, but I have two minds of this issue, and I totally understand that unlimited contact tracing is not sustainable. And I totally understand where DPH is coming from, and our nurses have been at this for a long time and they're burning out. But I don't know about you all, but I'm highly concerned about dropping off
too.
the requirements with where we are right now, especially with the breakthrough cases and just rampant transmission in our community. And it's arguable whether or not contact tracing at this point really prevents disease or disease spread, or is a really good mitigation strategy. But I do think that, you know, if we're getting additional money from DPH for a contact tracer, then maybe we can put that money towards some sort of mitigation strategies elsewhere. I don't want to put more work back onto the nurses. I totally understand that you need a break, but I think we have to supplement with something else, because right now dropping off our contact tracing, I don't think is a good public health idea.
I agree. And we're going to use that money to have Jane help the nurses. It's not only as needed, it's, you know, they haven't had a weekend off. So the money it's going to be used for contact tracing. It's just, I'm not going to hire an individual outside of the group and train them and spend 6 weeks. And if it's slow, they'll be like, wait a minute, you were going to hire me for 19 hours a week. So we're going to utilize those resources to get Jane into Maven to help the nurses immediately.
Which I am actually in Maven. I just need access to the towns.
So again, I know Great Barrington's nursing is primarily with the Alliance, but I still have concerns about Southern Berkshire community. I mean, as a collaborative, will the policy still be to go above and beyond what DPH is now requiring, or will we strictly just be contacting children, positives associated with cluster sites?
I mean, I can't speak for Amy and Joe, but I think we had similar conversations that they're going to do the best to keep moving the way they're moving. It's just when you get completely inundated and you can't keep up, that's we'll have Jane help out to help as much as we can. Yeah, I have concerns with it too, Rebecca, because it's like, what are we doing here?
Ellie?
Yeah.
Well, I also, if you can give me a very quick update on what the status is for the COVID testing. Because a lot of stuff's been coming out of the state as the home kits, but it's only eligible for certain groups, and it's this and it's that. So where do we stand on that? Does anybody?
I mean, the only update I know
Because
is
I'm getting a lot of questions about that.
The-
People want the kits. They're understanding from the news They can get them for free. They go to the suppliers, the, pharmacies, they are not free. And they are very expensive. Is that some way that when you're talking about supplementing, is that something that we need to be looking at? And I know we're very pressed for time, so.
I mean, the only update I have is that I'm not sure when the stop the spread subsidizing of the testing is going to end. The hospitals are still accepting testing. I know we do get a little bit of rapid test kits and we're trying to figure out how to best use that. A lot of people are purchasing home kits now, which aren't getting into Maven. So like, I don't know the answer yet, but I would circle back with Amy to see if she has any insight on that as well. But yeah.
Right, because the rapid test kits, the problem is that people are saying, I can't get an appointment.
Yeah.
And it's the same scenario that we've been having. But if we stop the contact tracing, which I totally understand as well, then, and the most absurd thing that came across the state conversation as well, we want people who are thinking the free kit availability is for, for the groups that can't afford them, but what they want them to do is be using them before they go to an event like, a rock concert. And I'm like, what?
Yeah, I don't know the
So-
full answer.
Pat, can we put this like a strategizing topic on our next agenda for where to pick up from maybe a gap
Yeah.
that contact tracing is leaving?
Yeah.
I've had thoughts about this, because yes, I'm not okay with not making these phone calls to people, but this is just my thought, I could be completely wrong. COVID's always gonna be here.
Yes.
Like the flu is here every single year. We don't contact trace the flu cases. This is scary. It's so many unknowns of what the future looks like. And I get where the state is coming, like, okay, this is here. This is here to stay. It's, get your vaccine, you need to get it every year. We've been dealing with this for how long now? And it's out there, like, what's isolation, what's quarantine, what do you have to do? Like, what's the number of days? So I think it's educating people, like, this is where you need to go look for that information.
Yeah.
I think that if we need to put, something on the news, social media or whatever, because it really needs to fall back on people to start taking some ownership for themselves.
But we should put it on the agenda for next month.
Well, and if I may, I think for me, I feel like getting out the word that there are funds available for employers for them to get reimbursed to give their people sick time, so that to provide an incentive for families who do the rapid tests to not just send their kids to school or continue to work because they can literally not afford to miss work. There's money out there after the America Rescue Plan, Families First. There was money before the businesses knew about it. There's still money through April. And I feel like doing targeted outreach to businesses and to families and to schools saying, if there won't be contact tracing, but it's really important that businesses support their employees and the state will reimburse them. I think there's like $22 million to do that or something like that.
Use the Chamber of Commerce, let them do the legwork.
And we talked about it at our meeting yesterday. So we'll be doing some of that as well.
And you'll let us know what it is that you're doing, so
Oh, yeah,
that we
no.
can be sure and talk it up with our community.
I would anticipate, and some of you have been on my list for a little while, but when anything goes out, I always CC my, I wouldn't say my friend towns, but like towns I have relationship with. So I would like anticipate that to continue. And we'll see what that looks like now that I'm official.
Yeah, and I think we're gonna increase our coordination and communication in South County once they have a dedicated person doing it. All right.
Okay, anything else? Comment, questions? Motion to adjourn?
So moved.
Second. Anybody not in favor?
Aye.
Thank you.